CJ.
I'm Adrian.
And together we are the
Two Crazy Cat Ladies.
I'm gonna cut you.
I think I just peed.
Buckle up. We're back in the closet.
Welcome to another episode of Back in the Closet with the Two Crazy Cat Ladies, where this week, guys, we are joined by someone that it is brand new to our podcast.
For the very first time.
For the very first time, and we are so honored and grateful for Dr. Katie Kangas to be joining us.
Some of you guys may already be familiar with Dr. Katie. She is a global game changer for the health of our pets. But for anyone who's newbie here, like doesn't quite yet know you, would you, this is our Annie Bell. On the podcast, you can't see her, but here live.
Oh, yes.
This is
Not all about it. I mean, it's just like perfect timing. I'm sorry, but that was just the best intro ever. Like you just asked her to do that. So.
Right. She's trained.
She
right.
is.
Pay her later.
She is. For anyone that does not already know what you are doing, literally globally, to help our pets, cats and dogs, to help their health, could you share a short intro, your background and your journey?
Oh, thank you so much. Absolutely. I appreciate it. So I have been a veterinarian for over 30 years. I can't believe that I can say that. Time flies. But I do really appreciate that with all those years has come so much experience, clinical experience. And I really feel so much value and so much reward in being able to use the accumulation of all of that to really help my patients and my clients to such a high level now at this point in my career. I started out, of course, doing conventional veterinary medicine. We all do when we, get out of veterinary school. And I did that for, 10 or 15 years. I've actually been a shelter veterinarian as well. So I was general practice. I was exotics and wildlife. I actually did some zoo work. And I did shelter medicine. I was the medical director of the Humane Society and SPCA in San Diego from 2002 to 2007, actually. And I stayed on part-time at the shelter for a while after that. But I fell into my love and passion for holistic and integrative medicine when my own doggie back at that time, when I was in the shelter in the early 2000s, my dog, my black lab, Asti, actually, here's the picture of her right here.
Oh,
she's my legacy girl because when she was 14, she started having a lot of weakness issues in her hind end and lumbosacral, spine, and started, knuckling and falling. And conventional medicine really didn't have much to offer her. I'd always been interested in holistic, but I just didn't really have any knowledge of anybody doing it at that time. But of course, our animals are our greatest teachers often in life. And she really gave me that push and that nudge to go seek out something that I'd always had interest in, but not made that extra effort to find it and do it. And so I found Dr. Keith Weingart in my area, who is a dear friend of mine and my mentor. And he's an amazing holistic veterinarian who's now in Oregon, in Portland, Oregon area. And with acupuncture and a diet change, of course, I was a kibble feeder back then. I admit it. All of us had to start somewhere. So I love alleviating my clients from any of the guilt of you are where you are. But once we know more, we can do better, And so anyway, after changing Asti's diet and starting acupuncture and supplements, she literally went from knuckling and falling down in her own poop to seriously jogging again. Like it was, and not that we were going for 10 miles, but I mean, she could literally, her quality of life just soared. And I was blown away. And I'm like, I have to do this. I have to be able to provide this for more pets and do this myself. So I resigned from the shelter. I went down to the Chi Institute in Florida and became acupuncture certified. And then, it, of course, all grew from there into, food therapy and herbal training and functional medicine training and, expanded to where I am now to really have this integrative focus. And one of the beautiful things about what I do in the integrative side of things is that it really is complemented well by telemedicine and telehealth. And when the pandemic came around, it just set the stage for a really good time to offer these kinds of services, and then became legal in my state, which is really great, to offer telemedicine and appointments online or on the phone for consultations to support, like you said, nationally and globally. Now I can have more impact and more reach to support people, and there's so many good resources out there. So many of, our network that we see all the time at the pet health conferences we're going to and all the events we're going to. But there are only so many people that do still one-on-one consultations. There's a lot of great resources and classes, but I like to do that, of course. And these, events are so fun. And even just being here and reaching a lot of people at one time. So thank you for all that you guys do to spread the good word and educate. But I love that one-on-one too, because a lot of times people just really need that, that customized guidance. And
Yeah.
so that's something that I really love to provide. And telemedicine for a holistic or integrative context actually works really, really well.
Yeah, yeah, and you think about it because it's that's one of the things, there's always blessings in disguise, but there was so many silver linings that came out of the pandemic, and telehealth in our world in the animal field is one of those that so many people were now, for how long we're telling people, find a holistic veterinarian near you, find an integrative veterinarian near you. And they're like, there are none. There's so many places where they don't have access. They can't get hands-on with a holistic veterinarian. So this is I think it's a beautiful thing.
I just want to piggyback on that because I knew I wanted to talk about this a little bit later, but let's just talk about it now because I feel like a lot of people explain to people how it kind of works, because I think there's a lot of benefit to it.
Mhm.
And not a lot of people recognize that a lot of times, correct me if I'm wrong, you will actually be working with their physical veterinarian
Their
or
conventional
be
veterinarian.
helping,
Yes.
explain a little bit to someone who's like, well, how do they,
Yep.
if we're not in person? Yeah.
Perfectly said. Thank you so much for asking, because that's true. A lot of people are kind of mystified by that when they call or seek us out, is like, how are you going to help my pet when you're not physically examining them and looking at them? And, amazingly, it works so well because even as a holistic integrative, I'm not a full service practice. So even people who are local to me and come into my physical practice, I am now very specialized. I don't offer, urgent care and, wound care and surgery and dentistry and all that. I did at one point, but I don't now. So we always tell people, you still need your primary veterinarian. And obviously, sometimes you may need a specialist, you may need an internist or a cardiologist or, et cetera. And so, we complement that. And now in a telemedicine context, I get all the records from all the veterinarians that are working with this pet. To the best of our ability, we get all the records in. So I'm reviewing all the physical exams that have been done recently and historically. I'm seeing all the blood work. And one of the nice things about what I provide is that oftentimes in today's modern medical, situation, there are so many doctors that have been, integrated into the case. If there's a cardiologist and a neurologist and whatever, and a primary, but oftentimes nobody's really overseeing the entire, network of things that is going on with that individual, and everybody sees their little sector and not putting all the pieces together in a holistic whole body health standpoint. And
Yeah.
so I really love to provide that as I'm helping to assess all the parameters and help support that pet parent to put the pieces together in the way that makes the best sense for that pet and in a way that's most integrative. And there are adequate times where medications can be necessary or be helpful, but oftentimes, as we know, they're overused or they're relied on for too long. Instead of being a temporary, let's get through the illness into a better place, it's a lot of medications that just keep getting layered and layered and layered. And so, from an integrative standpoint, my value to people is really to help create a wellness plan that takes into context everything that's going on for that individual, that's very customized, putting together the pieces from the conventional veterinarians that, their recommendations that are making sense for that pet and working for that pet, or reducing some of the things that aren't making sense for that pet, and bringing in other holistic or integrated strategies to, get to a better outcome and to also minimize the amount of pharmaceuticals and other things that we need to be doing.
We could use of you in the human health world too.
Right.
When you think about it, like so many people that have like chronic diseases, and we've seen it so many times, like
They're
with
not
our
talking
friends and
to-
family, where it's like they have to go to this doctor and this doctor says that, and then that doctor says that. And, we've lost people in our lives because literally the doctors were not communicating. And so they clashed and we get death. Right. So it's like, there's, or more illness or whatever it is. So yeah, I think that's absolutely beautiful. Dr. Katie, I just got this random idea that I have to say out loud. But we have been talking for years, like almost 10 years now, about how could we help bridge the gap between, or what will bridge the gap between conventional health and integrative holistic health. Like at some point there has to be what if it's telehealth that actually does that? Like what if it is because these doctors are now like, oh, okay, you're going to work with this doctor and with me, and we're going to be,
it's like
a
teammate.
Isn't that great? And I actually have a growing number of pet parents where their primary vet or their conventional vets know who I am, and they're like, okay, talk to Dr. Kangas about actually a case, a patient with kidney issues where the vet, and this one's local, but I do have, vets from elsewhere now that I've been speaking at, AHVMA more, and more veterinarians are, hearing some of this stuff that I'm teaching, that I have more and more people referring to me. And I even had a case recently, and it was a doggy, but with kidney issues. And they were like, oh, you see Dr. Kangas, you can talk to her about diet. We'll just tell you from our side. And I was like, yay. They trust me with talking, because they knew that, that pet parent was not going to want to just jump to a low protein. This is a perfect segue into our conversation, but jump into a low protein diet. And it was really nice that, they supported my client to work with an integrative veterinarian on that piece of things to, get the comprehensive approach. So
beautiful.
And
it's so beautiful. I love it.
Yeah, we are going to jump right into kidney disease, but I do love, even your story and so many stories of conventionally trained vets that go into integrative and holistic health. It is such a beautiful reminder to all of us cat parents, like you were working your bahookie off in shelters or all that stuff, and you think about what your day is like.
That's not a word I hear you say often.
That's your hairless pink bahookie. That's what that is. Being very busy, and sometimes it does take a nudge, usually from one of our beloved pets, to give us that kick to take the time that you may not think that you have to learn more and to do more and to share that with the bigger community. And I'm just so grateful for it. And I know that it's oftentimes a tough journey, but so grateful, especially as a busy veterinarian, to recognize the value of it, to see it for yourself, and to take it forward in this way that is literally changing the world.
Yeah.
With kidney disease, this is such a huge epidemic. Why do you think? Why do you think it is? Yeah.
Yes, in cats specifically, you are right, and not that dogs and humans don't get kidney disease. But I tell my clients this all the time. It's like if cats make it over 15 years of age, and they don't have elevated renal values, we're shocked as veterinarians. We're like, wow, really?
Right.
Don't have kids. It's like if cats get old enough, we just expect that they're going to get kidney disease. And we're like, wait, all geriatric humans and all geriatric dogs don't get kidney disease. Like, why do all geriatric cats have to get kidney disease? That doesn't make any sense. But it's just been sort of the accepted, norm for a long time. But I think that it really is, I think most holistic veterinarians are very aware, it really, the number one kicker goes back to a species appropriate diet that is moisture rich, and that evolutionarily cats, originate in like Egypt and very arid conditions, and most of their water was consumed in their prey. And then in modern situations, which, modern pet food diet's only been out like 100 years or less, right? I mean, that's a very small snapshot in time. And it is so unnatural for them to eat desiccated and dried food all the time. And then as the modern way of the world has, catapulted forward, not only is the food dry, but it's heavily processed, it's overheated, it's got lots of toxins in it, and, preservatives and all these other things. And so lack of moisture kitties, they call them, poor drinkers. Cats generally will not drink enough to make up for eating dry food.
No.
Dogs eat dry food, they'll go to the water bowl and slurp down a whole bunch of water to make up for it. Cats generally aren't going to do that. They're just going to be like, hey, my kidneys were designed evolutionarily to be very, efficient. So I'll just make my kidneys work a little harder and I don't need to drink. But over years of time, that obviously takes a toll. And younger and middle-aged cats, we see a lot of bladder issues, obviously, a lot of urinary tract, bladder stones, bladder infections, inflammation, cystitis that sometimes doesn't even have infection, associated with it. But of course, the whole urinary system, kidneys and bladder and, urethra and ureters, all of that is affected by chronic dehydration. And that really sets the stage. And then in modern pet food diets, and I hate to say human diets, things are heavily processed. They're overheated. We're talking AGEs. Then we've got glyphosates. We've got, the BPAs and all this kind of stuff. Ethoxyquin, by the way, is a preservative that's used, you are probably well aware, for fish. And so I have so many clients that are like, oh yeah, they eat nothing but fish varieties or, dry food that's all fish. And that's, a lot of ethoxyquin too. So, and that literally causes kidney failure. I mean, that's like direct, but glyphosate does too. And glyphosate is much more of an issue on plant crops, but the grain-free foods, which of course we want grain-free for cats and we need low-carb diets for cats. But one of the big issues with grain-free for dogs and cats is that a lot of the grain-free foods, which are still carbohydrate, like lentils, peas, chickpeas, all that kind of stuff, is laden with glyphosate. I mean, higher levels of glyphosate on those foods than even on corn and soy. GMO.
Yes. Yeah. It's sad because they are it's the only way that they know of, right? To replace those grains and get it grain free is to put more carbs in it. And it's like, this isn't healthier. Neither one of them are healthy, especially when it comes to an obligate carnivore.
Exactly.
Right.
I love that you just spelled it out like that. And
You
that
did
really is
so well.
It's so true because, you don't often think about, not a lot of people, I know I didn't even look at what the ingredients were. If you see, so recognizing that what we think is doing better is actually
because exactly. I love telling people just because something is grain free does not mean it's low carb. And in fact, at least for sure in the dog foods, that a lot of the grain free foods are actually higher in carb than foods that aren't grain free.
Yeah. And
and then once I met Dr. Zach Bush. If anybody is familiar with Zach Bush, he's an amazing, brilliant doctor who, and I'll talk about his product because I think it's so fabulous and, worthy of talking about today. But he happens to be an expert on glyphosate and soil science and, integrative health and gut health and all of that and microbiome health. And so when I met Zach years ago, I literally was just about to write an article for Dogs Naturally about grain-free foods. And I was like, hey, what's this whole thing about, lentils and blah, blah, blah. And he brings in the whole glyphosate thing. And I'm like, what's glyphosate? Like, this was years ago. And I was like, what? And so I delved into research. The next year, 2020, I actually gave, because it was 2019 when I met him. In 2020, I actually gave 2 lectures at the American Holistic Veterinary Medical Association on glyphosate, 2 hours. Part 1 and part 2. And that was big. And so I learned so much and then shared so much about that. And lo and behold, glyphosate is water soluble. So when we and our kitties and doggies are ingesting it in foods, it gets excreted through the kidneys. Right. And that is a big issue. And so, and of course, we're spraying this pesticide all over our planet, especially in the United States. It's water soluble. It seeps into the ground. It reevaporates up into and comes back down in rainfall. I mean, the fact that it's water soluble means it can get everywhere. And when it gets into the body, our bodies are 70% water. It's like getting everywhere. And then, boom, it has to go out the kidneys. And so you may be aware, and if all of our, audience and listeners didn't know, glyphosate, which is Roundup. Okay, so glyphosate is the main pesticide ingredient in Roundup. And now there's a lot of generics, but that was the original brand name, that glyphosate, that chemical, causes is one of the big causes of leaky gut, but there's a lot of causes of leaky gut. So it's disrupting that tight cellular junction, of the cells, the cell membranes in the gut lining, the mucosa of the gut, and that leads to leaky gut, which leads to a whole ensemble of immune issues and microbiome imbalance and all these kinds of things we don't want. But lo and behold, that same type of mucosal barrier with the same types of what are supposed to be tight cellular junctions, those exist in the kidney tubules as well. Same exact scenario. So when glyphosate is being excreted through the kidneys, it is trashing the kidney tubule barrier, and it's also lending into kidney failure. Okay, it's affecting the kidney filtration system because it's loosening that up. So when we get like protein losing nephropathy or just, kidney tubules and nephrons that aren't working well, not to say that glyphosate is the only player in the game, and we talked about foods and all these other things that are an issue, but it's becoming a big player with the levels of glyphosate that everyone in our country and our planet are consuming today, especially our pets. Pets consume probably far more than. Woo! She's like, she's included. Yeah, she's like, look at me.
Come forward to our special guest.
There you go. So yeah, so that. Yeah.
So it being an epidemic, obviously multifaceted, but you mentioned first and foremost, the big thing is obviously food. You are incredibly empowering for your knowledge of preventative care and preventative protocols. Knowing that feeding a species appropriate diet is going to help ideally down the line to avoid these issues, but also recognizing the environmental and in our food and in the environment.
Yeah.
What also impacts, do you have, what is a good preventative protocol? If for someone that, like we've got 5 young ones, we never want to, we're feeding a species appropriate diet. We know that there's probably more that we can be doing, as you just mentioned, all the glyphosates and how that impacts all their innards. Do you have an idea of what you would recommend,
like ideally,
as a preventative protocol if we're doing a species appropriate diet, we're trying to feed a good food?
And we'll get to it, because I'm sure so many listeners and viewers here are already dealing with kidney disease. But like to start, like for us, our oldest are 6 right now. Our 2 oldest are 6 years old. So what would you say to someone who is like has a fairly healthy cat right now that to prevent this long term? Yeah.
Moisture rich diet, again, species appropriate, which is going to be low carb, hopefully either unprocessed, raw, or very low processed, whether it's, kitties are kitties. So if they, the freeze drieds can be okay and things like that too, but we want as much moisture rich as possible. We also want high quality meat protein or animal based protein versus, obviously, what I love to tell people is protein on paper is often obviously not animal protein. And so the whole thing with the phosphorus and the low phosphorus thing with kidney disease is when you're looking at standard pet foods that typically are kibble, but could be canned too, is that when you're looking at the crude percentage of protein in that diet, if these are all rendered just poor quality proteins and you've got beaks and toenails and feathers and all this kind of stuff that's being ground into it, keratin, like fingernails, on paper, that's protein. That's percentage of protein. But there is no usable digestible protein when a kitty or a person or anybody is digesting those kinds of things. You got a crap ton of phosphorus to deal with that your kidneys have to excrete. And you didn't get any amino acids out of that. You didn't get any usable protein. So I always tell people when they're so nervous and they come to me and they're like, oh, my conventional vet said the BUN is 35 and I need to feed a low protein diet. I'm like, no. But, I always love to give that distinction is if you're feeding a species appropriate, especially fresh food diet with quality animal proteins in it, then you're already so much lower phosphorus, higher digestibility, much more kidney friendly than a standard pet food diet. And conventional veterinarians, they just don't, they don't get that. They're not connecting the dots with that piece at all. So they just think that in order to save the kidneys or spare the kidneys, that you need to do low protein. And by the way, studies have shown, even conventionally, studies have shown for veterinary medicine that preempting and feeding low protein to an aging cat does nothing to prevent kidney disease, by the way. So when we're talking prevention, don't think that an older cat just inherently needs less protein. That is not true.
No, thank
always
you for
think-
saying that. And they waste away so much faster because again, they're obligate carnivores, right? They need that good quality, right? Like we always say, it's not that our older cats need less protein; they need higher quality protein than this crap that you were feeding in these
Absolutely. Yep. So back to your prevention thing, high moisture content, quality protein, as organic as possible as we can do, get minimizing as much as we can the toxins that they're exposed to, which include glyphosate and Roundup, but lots of other things. Because again, the biggest filtration system in the body is the kidneys and the liver. And so, the less that the kidneys have to get taxed with throughout life, the longer they're going to function better. So we love to be as preventative and proactive as possible.
Yeah.
I love that. It reminds me though, how many people say, that they do remove all the protein so that there's, and I think it was Dr. Chris Besson that was trying to explain to people, you watch these kitties just wasting away, like just turning into skeletons. And she says, basically it's because they are obligate carnivores and they need that protein and those amino acids so bad that they're literally cannibalizing their own muscle mass.
Yep.
And that is just like, I know it's difficult, and conventional medicine goes so far, and there's not. I think it's changing. The needle is moving. You're helping to do that as far as knowledge, but it's difficult when your common sense is showing you this is not helping. You're watching your kitty waste away, and that's
exactly. And the diets aren't palatable. It's hard to get them to eat it, et cetera. But low protein, like you said, it just causes more muscle atrophy. More muscle wasting, and then things catapult from there. I mean, then they feel like crud and then they don't want to eat. And I mean, it's just a vicious cycle. And interestingly, and I think you wanted to talk about stages of kidney disease too.
Yeah.
There's a great article, and I could share the link with you to post for, all of your listeners. But it's an article from, what's Wendy's last name? I've got it right here. Dr. Wendy Brooks. And she's a board certified veterinary practitioner, and she's got an amazing article out there. And she talks about how if you guys have heard of the term IRIS, or the acronym IRIS, is International Renal Interest Society. Interesting. So IRIS, they call it the IRIS, sounds like the iris of your eye. The IRIS stages of kidney disease. So they've been labeled, as these stages. And so there's stage 1 through stage 4. Stage 4 is super advanced. Most cats, when they're diagnosed, might be in stage 2 or stage 3, but stage 1, the creatinine isn't even elevated yet. Okay. And then stage 2, it's in the sort of higher end of normal range, but then the SDMA, and we can talk about these tests, goes up a little bit. But what I'm seeing is so many conventional veterinarians are, even if there's a slight elevation in one of those values, they're recommending a low protein diet. And what Dr. Brooks puts in this article is that they've actually studied this and found that there is no research or evidence to support that switching to a low protein diet before stage 3 helps at all. Okay. But the IRIS Society recommends to start recommending a low protein diet in stage 2, because they said these diets are so not palatable that by the time kitties get to stage 3, their appetite has fallen because they're sicker, and then they won't convert to that diet. And so they're like, just change their diet ahead of time so that they're more like, I know, right? So this is literally how this is based on. That's where the line of reasoning came from, is that there's no evidence that this is going to help, but we're afraid that if you wait until they're in stage 3, that they actually won't eat this food. So we're recommending that you switch the food over sooner, which of course, from an integrative standpoint and all the knowledge that you both have already, we know that just sets the stage for the kitty to decline faster.
Right.
Because we're already putting them in, a challenging situation by lowering their protein. So it's a darn shame that, that's literally the reasoning and the ideology behind this. And she's got a wonderful, and I wouldn't even mind just reading, like I highlighted a couple things that I thought was really good to share. She says in a nice little bullet point in the article, there is no protected value to restricting protein prior to the onset of kidney failure. It is not preventative or at all helpful for a healthy senior pet to be restricted in dietary protein. Second bullet point, high protein diets do not cause kidney failure. Although once kidney failure has been begun and they're in later stages, high protein, especially depending on the type of protein, can impact it. And then the third bullet point I thought was really cool. Protein restriction is probably the least important dietary modification in early stages of kidney disease.
Wow. Wendy Brooks.
Whoop, whoop, go Wendy. Yeah. So, and she says there are special diets available for patients with less restrictive needs and others for patients in more advanced states. So again, with integrative, we want to be as customized as possible. I love a definition I heard of integrative medicine for human too, anybody that I heard recently that I love is N of 1. N is your sample, N of 1. So when you're saying N of 1, you mean this individual. What is going on for this individual? Like, talk about being so customized. And this is something that sort of ties into at least that statement of choose or be looking at diets that apply to where that patient is right then, but don't put them in a whole lump of, you have a tiny little elevation on one value, so you have kidney disease and you better eat low protein. And that's so far from the truth.
No, it's so sad. We actually recently, it was our digital marketing manager, believe it or not, and she has cats. And she said,
of course.
And she said, I'm so sad because I just found out that my cat is turning 7 in a few months and now has to be on a senior diet. And I was like, whoa, what? What? No, let's not do that. No, that is not true. But it's out there, like, just because they're old, they don't even have like.
Right, and let's not say 7 is senior for Pete's sakes.
Right.
Well, I'm thinking seniors like 13, not 7.
Yeah.
Right. So yeah, but
what's exciting about, especially there being more published papers helping us all to better understand this. Yeah. I think one of the things that we run into quite a bit is that we have so many people in our community that come to us and say, my cat's been diagnosed. And you say, what stage? And they really have no idea. And there are even some, excuse me, baby girl, excuse me. There are even some people that will say, my vet says there's really no cure for kidney disease. So we're looking at euthanasia, and we're like, what is their quality of life?
Yep.
What is going, you know what I mean? So, so I do think this discussion on people understanding that there are stages to the progression of this disease
is so important.
I agree. But I also, with the caveat that staging or the nomenclature of the staging has purpose and it does have value, but I also think it freaks people out. And they hear my cat has stage 2 or stage, it's like, it sounds so much worse. So I was like, okay, super mild. Okay, we're getting into moderate, and, and we can stage it to be, to follow exact nomenclature and stuff like that. But, again, I think stage 2 is still early-ish in the game. But the other thing too is that cats can live with kidney disease or failing kidneys for a long time, and so again, it's no immediate death sentence, and there is so much we can do. And of course, I get so excited from the integrative realm that, again, conventional veterinarians, the only thing they know to do is to lower the protein, and then they're like, okay, we're done, we don't know anything else to do, unless they're to the point where they need fluid support, and then they'll recommend maybe some sub-Q fluids, at home 3 times a week, or whatever is appropriate for that kitty to support them with extra fluids, and that makes total sense. Right. But from an integrative standpoint, there are so many things that we can do to support them, and obviously diet is number 1, so we're talking about that first and foremost. But there's herbs and nutritional supplements and homeopathy, and I love your kidney kit, by the way, with the 3 products, with the VitaCat and the Catalyst and the OxyCat. And I always told, and now I'm loving your Catalyst product because I'm so big on digestive enzymes. And when I found out you guys had a liquid digestive enzyme product specifically tailored for cats, I'm like, Digestive enzymes, I mean, they're always a beautiful thing, and they help gut health and they help inflammation levels in the body. And there's so many reasons for us all to take digestive enzymes. But on the topic of kidney issues, digestive enzymes are also very helpful, because when the kitty is able to digest down those food, particles and molecules to the, absorbable, molecular size and components that the food should be in for better absorption, utilization, and even excretion on the back end, that's going to help spare the kidney function, from working harder. So digestive enzymes, proactive, love it.
Be helpful.
Yeah.
I love that.
Yeah. I have a quick question, because I actually saw this on Facebook today. I don't know where I was. It was just on a post, but somebody had said that they were doing just nutrition and a supplement. I think it was like a kidney gold or like a nutritional herbal supplement for their cat. And they went from stage 2 to stage 1, I believe, is what they posted. And people underneath were like, that can't happen. Have you ever seen kidney disease be reversed or improved? Yeah.
Absolutely improved. Yeah. And this is a great segue then to talk about, testing, because now, well, I'll just say, because I saw your segment too with Dr. Chris Vesson, and that was so amazing. And she, explained this really well too, is that the BUN and the creatinine levels, which historically are what we're looking at to, at least historically, most routinely to assessing kidney function, BUN and creatinine don't start to elevate in, the blood sample until about 2/3 of the kidney cells, the nephrons, are already non-functioning. However, right, so it's sort of a later stage, measurement. However, dehydration affects BUN and creatinine.
Right.
And cats are oftentimes, if they're not on a species appropriate diet, they're chronically dehydrated, or at least borderline dehydrated. So the other thing that I think is uber important is that you need a urinalysis test side by side with that blood test to see if the because if the urine is really concentrated, you can't have kidney failure if your urine's really concentrated. Like, your urine is going to get dilute. The kitty's urine is going to get more and more dilute as we get later in the stages of kidney problems. So if you have a very concentrated urine sample, that is a very different picture with a high BUN and creat than if you have a dilute sample. And then the other test that should be really standard now is called the SDMA test.
Yeah.
And that test is an earlier indicator than even BUN and creatinine. And the SDMA, instead of measuring these things that are building up in the bloodstream, the urea, because it's not getting excreted through the kidneys, appropriately, the SDMA is actually giving us a marker or a measure of what's happening in the filtration system, how well the kidney tubules are filtering. And that is pretty cool. And so anyway, and I can talk about the product that I was going to mention. I guess this is just as good of a time because that's how I think of this product, as such a great value for that specific piece. And this goes back to the discussion I talked about Dr. Zach Bush. And if you can see with my lighting, his company name is ION, which is an acronym for Intelligence of Nature. Okay. ION. So this product is soil derived. It's liquid, and fortunately, it tastes pretty much like water. So cats usually don't mind it at all. Their full dose is a half a teaspoon twice a day. It can go right in their food. You could put it in the, you could give it by mouth, and that's fine, but it could go in food or broth or raw milk or whatever. Humans, we just take it off a spoon. I squirt it in my mouth. And this is the stuff that not only helps to keep the tight cellular junctions intact in the gut, but in the kidney tubules. So one of the first things that if I see a higher SDMA, I'm like, hey, let's reinforce those kidney tubules, because when you do that, the filtration system is working better. And there are actually excellent studies on this product, and they have a human formula too. Highly recommend. The human bottle has the green strip. It doesn't say for pets on it. But the brown, label bottle is the one for pets. And it's marketed for, well, actually it says right on there, I don't know if you can see, it says kidney function is actually the first thing. And then digestion, vitality, immune.
Yeah.
because they did studies on six species. See, they're all people: cat people, horse people, dog people, rat people. They did studies on lots of species and found that every single species gained filtration system benefit with their kidneys with this product.
Wow, that's amazing. I did not know
That's-
that about this product. I didn't.
Yeah.
That's
So
awesome.
it's a win-win because it's gut health, also sets the stage for a better microbiome, etc. But it's phenomenal for kidneys. So love it. And it's unique. So, usually when I talk to my pet parents, I'm like, okay, what can we do from the nutritional realm? Let's talk about the diet. What can we do from nutritional supplement realm? I know you guys are very familiar with standard processed supplements, which I love because they're food medicine and they have glandulars and organic plant materials to help support kidney function or whatever, we're using the feline renals for the kidney function, but they have a lot of formulas that are supporting the body to heal and maintain better in health on food. But then we can also bring in herbs, and then we could potentially bring in homeopathy. Omega-3s have a big value in kidney health, but this ion is so unique. So I love to put together a small compilation of things that, that comprehensively add up to a better outcome for the patient without overwhelming the patient. So we'll always take that into account. I love to tell people when it comes to kitties, my classic line is less is more, and we try to, I generally would recommend more numbers of supplements over time, not all in one, visit or anything, but I generally might front load dogs with a few more supplements than cats. But with cats, I always try to just be super choosy and slightly more minimal and do things that are high impact for them, high priority, that are easy to get in. Obviously, I'm like, it could look great on paper, but if this is not palatable and you can't get in your cat, like, forget it. What good is it?
Right.
So this is a lovely one because it's so impactful for so many things in the body and it tastes like water. So
I love it. Integrative Veterinary Care, thank you so much. Just dropped the link. And Innovative Veterinary Care is your
thank you, team.
yes.
Woo, woo.
Awesome. Back to the testing because are the testing that you recommend when you're talking about BUN, creatinine, is the SDMA, and what was the other one? I'm already forgetting.
And the urinalysis.
Urinalysis.
Yep.
Is that standard, or is that something that if your vet says, "Ooh, we've got elevated kidney levels here," is that what you ask for? I mean, what I'm basically asking is, you're finding yourself in a situation, your cat has elevated something levels. The best way to talk to your vet, like the right tests to ask for, how to kind of get over that hump of the prescription diet that they want with the less protein. What are some of the big tips for that? And especially with the testing, specifically, do we have to ask for those, or do you think it's standard?
Yeah, that's a great question. In an ideal world, you shouldn't have to ask for those, but oftentimes you do. And I am sort of embarrassed to say, but there are a lot of veterinarians who literally will diagnose kidney disease without ever checking a UA. I see it all the time. They will check blood work and they will literally assign the pet with kidney disease, and they'll even stage it and everything, and nobody's ever even looked at a UA. And it's like, it's kind of an important piece to put the pieces of the puzzle together. Yeah. So that should be so standard, and I hate to say it's often not. Now, if you went to a specialist, I mean, you're not, if you go to an internist or something like that, but they're always going to do that, but there are a lot of primary veterinarians out there that are still pretty conservative with really being thorough. And that's the whole thing with integrative veterinarians. I mean, sometimes I get records in from, this pet's seen 5 veterinarians, and I'll be like, hey, no one ran like this test, like there's, that. And so that's the focus of integrative. I mean, we love to be thorough, but I mean, that really should be standard. UA and now SDMA should be standard as well. But sometimes you actually have to ask for that test. And there are some veterinary labs that don't include the SDMA on the standard panel, and it might be an add-on or a special request.
Wow.
I mean, I know we already talked a little bit about telemedicine and the services that you offer, and I'm happy to say that link to Integrative Veterinary Care, which also has the ability to make an appointment with you, is linked in the description here. But that really is such a great, because when we get a diagnosis, of any kind, it can be overwhelming and we forget the questions to ask, or we don't really know which direction to go in. And not only would it be helpful as a cat parent to feel more empowered about the decisions, but also that communication with our conventional veterinarians to have, another professional teammate on our advocacy team for our cat, to really help us navigate it efficiently to the best of our ability. Especially with disease, it's like, oh, well, they sent me home with a bag of prescription food and, now they won't eat it. And now what do we do? And
it's sometimes hard, especially if you don't necessarily know how to communicate with your veterinarian. Maybe you know better, like you've already been like even Adrian. It wasn't like too many years ago that like we would never feed a prescription diet. We know that like we know better now, so we do better. But she was at the vet alone with one of our cats, and they were like, this is the bag that you need.
The hydrolyzed protein diet that you need.
The hydrolyzed protein diet. And she was like, oh, I don't think that's
just awkward.
And she was so
it is awkward. And
which was, I think we tell people all the time. She called me, but she was like, so they want a hydrolyzed protein diet. They're saying that
you went through that experience to help you to guide, because you're such a wonderful asset to so many pet parents for the education and the insight, and that just made you even better at supporting people. So it was really cool that you went through that, but it is really awkward.
I was like, well, who are you? What are you talking about? Why?
Oh, well, I think it's $87. She was like, what are you talking about? And I was like, oh, so maybe not right now.
Like, maybe I should decline this. Right.
I was like, oh, this is a fake phone call. Okay. So she could blame it on me. So she could be like, oh, no. She said, I can't do that.
But
it is so good to really know, what to ask, how to feel a little more confident, respectful, but confident in communicating with the veterinarian, offering some of, your input and ideas and questions. I mean, questions should always be, welcomed from the practitioner. But also now with talking about the tests that people can ask for, it is nice to be aware of those, because then, tracking and doing follow-ups will also become, more sensible for people to figure out what's going on. And back to Jay's question, which was such a great one, I do see stages drop, and we can see, kidney disease markers get better. I see it all the time. So the BUN and the creatinine can get better. The SDMA can improve. So again, once you, especially with a multimodal approach of some nutritional stuff, some, very strategic supplements, some herbs, etc., some omega-3s, some ion, gosh, we have so many good tools. Your kit, it's a beautiful thing. And that, of course, why wouldn't the kidneys get better with all that goodness coming in, right?
That is the best segue to this question. Because we are so grateful and so excited about the growing number of resources that are out there, natural resources, helpful resources that are out there for our cats.
Look at her opening the drawer.
You see her opening. She's trying to get into our sock drawer.
I love it.
She has a handful.
Kitty stars.
This is
stars of the show. I love it.
Yeah, she is. She definitely knows when she's on camera. So it's incredible to see all of these amazing resources that are available. Almost 10 years ago when we started this, specifically for cats, there were not a lot of things. So it's exciting to see so many new things coming to market that are helpful, that are natural, that are amazing. But you are doing something we have never seen done yet. Yeah. So please explain a little bit about, because this is so exciting. Dr. Katie's Remedies. It's a line of products that you have, and the concept of share your bowl. This is where you really just.
We love it.
It's brilliant.
We love it.
So
and we've never seen like homeopathic supplements in this way, like given in this way. It is beautiful, so easy to understand and like.
I'm going to show it in a second, but tell us a little bit about the line. Tell us a little bit about it.
So thank you so much for asking, and thank you for your excitement too. we just rolled out this line, and the company name is Share Your Bowl. And it is very unique and has a cool story behind it. And it was really born out of my team hearing me tell our clients for so many years that, oh, this supplement is made for humans, but we use it in pets. So, that's why I'm prescribing it. And, this is the dosing that you would use for a pet, but feel free to share the bottle because your dosing's right on the bottle. It's for people. And then on the flip side, I'd be like, hey, this brand's made for pets. It's awesome for people. Taste it. It tastes really good. Like, you can take it. Feel free to share the bottle with your pet, or, feel free to share your pet's bottle. And then when it comes to food, they'd be like, oh, you should eat fermented foods, just like I'm recommending for your pet, or bone broth, or raw milk, or, these fresh foods. And people are like, oh, I should eat that for myself. Why, yes, you should. And so, it just came about. Actually, I would send, pictures of my pet's dishes of what I was making, and I'd send them to my practice manager, Jessica. And she would send back, and she's like, is that your dog's food or your food? Like, she couldn't tell, and I'm like, well, that one was for Sage, but my bowl looks the same. We're both eating this. So it was really cute. So then Share Your Bowl came about, and it, really the passion behind it is that so many things that we want to do to support our pets' health are what we should be doing to support our own health. And there's so much crossover and alignment in us all doing healthy things, for ourselves and our pets. And so all of these products that we're developing literally can be shared with amongst the humans and the pets. And so the homeopathy line, and most people probably know, homeopathy is, you can use it in every species. I mean, you can use it in birds and chickens and, anybody. Like that.
Recently treated our tree with homeopathy.
OMG. Now that is a cool story. I love it. Yay. Yeah. I mean, homeopathy is amazing. And it's classically so gentle. And so, it doesn't contradict anything else. I mean, it's just a nice add-in. And then the unique thing that we did with with my homeopathic blends is that we made them in the pelleted form so that people can hydrate it yourself with purified water, because most homeopathics come in, an alcohol solution so that it's stable at room temperature. And that obviously has, purpose. But then when you go to give it, doesn't taste so good. And the first couple times a kitty tastes it, and then you get out the bottle and they run away because they're like, oh, it doesn't taste good. So the great thing about these in purified water is that there's no flavor. Cats don't mind them at all. Nobody minds them. You can either put it directly in the mouth and inside the lip or anywhere in the mouth, or you could put it, in the food. The one thing with the fact that there isn't a, something to stabilize it, a preservative in it, is that it will have a finite, duration of use. Yeah. And 3 months is what we recommend, and to keep it in the refrigerator so that it will be stable. And then after 3 months, you can just discard it. And so if they're going to stay on it, or you're going to use it, again, or long-term, then you'd obviously replace it like quarterly. So.
But something that I really love about that is that helps us to have something preemptively, right? Like proactively. We can have this on our mobility.
Detox.
Your cat's older at some point, right?
Right. Yeah, because pellets are going to last for a long time, like literally years. Right. So if you get the bottle and you just want to have it on hand, especially the tummy, oh my God, it's such a good remedy. So the tummy remedy, which has Nux vomica and Hepial and several things in there for anything from, nausea, poor appetite, vomiting, stomach cramping, literally pancreas, colon. I mean, really the whole GI system. If there's anything going on with upper GI or lower GI, that stuff is amazing. Yeah. And the thing is, it's a great thing to have on hand, honestly, for humans too, of course, Share Your Bowl. But the beauty of it is if you order it and you don't need it, you can just, not hydrate it until you need it. And then that just, lengthens the life of the product a little bit longer until.
I also love that on the side of the label, you have a little area where it says date hydrated or date mixed.
Right? Yes. So you can remember. There you go. Yes. Very thoughtful on my team's end of doing that. I love it.
I love that. It's so perfect.
And
Robin are super smart. Yep, go ahead.
I'm hoping we have a couple seconds left for a couple questions because I saw them coming in.
I know there's so many good questions, and I would love to ask
This right
questions.
here, sprouted superfood bowl topper. This is going into dinner tonight.
Oh, if you guys have tried, like literally pour it in your hand and lick it off your hand. It's so good.
It is. I'm like, smell it. It smells so good.
Yes, it's so good and it's so fresh. And that's the turmeric blend. And then there's the black truffle blend, which of course truffles are from the mushroom family. So the black truffle one is our antioxidant formula. The turmeric one, whoop, whoop, is our anti-inflammatory. But it is a super food sprouted seed and spice powder, or spice blend, I should say. And it is so flavorful, but it's so medicinal and health giving. I mean, it's a beautiful thing. In fact, I have this book right here, which I just love to tell people, healing spices. So this is an Ayurvedic doctor who wrote this book. But I will say that a lot of times people tell me, especially if they're home preparing food for their pet, like, oh, but it's really bland and I just cook and it's so bland and I don't put anything in. I go, oh, that's a shame. Like, it doesn't need to be bland. And spices are, it's not like we want to put like loads of salt in, but a little bit of salt is actually in fact, a lot of times there's not enough electrolytes, including salt, in a lot of people's bodies and pets' bodies. And especially, potassium and things is certainly with kidney issues with that topic. But this is a way to get healing and flavorful toppers in our foods and our pet foods. And the superfoods in there are sprouted seeds like chia and hemp seed and sunflower seed, and pumpkin seed and all that kind of stuff. And anytime anything's sprouted, it's so much more nutritious.
Yes.
And it's all organic. And I love that. This is even the label, it says powered by love. And in the ingredients, at the end of all these gorgeous organic ingredients,
it says
love. And love. And
Yes.
The more that we learn every time we talk with Dr. Barry Sands, it becomes so much more.
Dear friend Barry, yes.
She
Love
just.
her.
We'll be on next week on our podcast.
Next week.
Yay.
It just becomes more and more apparent just how much energy matters.
In fact, intention, energy, and that's even literally when you're feeding your pet, when you're putting the ingredients in there. If first of all, if the ingredients came from a good place, there's already a higher vibration energy in them. If they're organically grown and not pesticides all over them, or if they're animals that were raised, ethically and all that, there's so much better vibrational energy already in there. But then even just the energy of the preparer of the food is that you're literally affecting the vibration of the food as you're putting it together and serving it.
True. I've told the story so many times. So forgive me for repeating myself, listeners, but like we talk about the fact that, at some point and some points, I'm sure it'll happen again, where I'm like super stressed and there's just a lot going on and, my anxiety is really high. And I get up in the morning and I'm preparing our cat's food and I'm doing it like thinking about like all the things I have to do today in a negative way, or all the things that didn't get done. Like why didn't she clean the dishes, and why didn't, like all that negativity.
She is me.
Or whoever, might be here. And then I put the dishes on the platters and I pass it out and I'm like, why isn't anybody eating? And then it'll dawn on me, damn you. Like you really just did that. You put all of that negative energy into their food and that's why they don't want it.
It's so good to share that with people because that's a little component that probably a lot of people really don't have awareness on. I mean, it's not sort of intuitive common sense, but once you understand that, it really is a game changer because you can't unlearn it now. You're going to be totally plugged in. And I would just love to tag on to that great sharing that you just did, that when I was just at the Feed Real Summit and I actually gave a workshop in the Feed Real Summit and it was on making thoughtful treats for pets. And it was for, the summit was for dogs. So it was of course making dog treats. And of course it was the whole share your bowl thing because it was like, oh, these treats you can eat and your dog can eat and there's superfoods in it. But I actually talked about the intention and we went through a breathing exercise to just get into the parasympathetic and out of the sympathetic fight or flight and stressy mode that our brains are all blah, 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 monkey mind going on, and just breathe and center down. And we played music and nice music to get our vibration going and uplifting, and then made the treats. And it's like, now you feed these to your dog or yourself, and they're going to have a higher vibration and feel better. But one of the, it was actually one of the Coco Therapy twins that shared her story. Oh my God, it was such a beautiful story. And when I was talking about this whole thing with the vibration and your mood and your energy plays into what's going on with feeding your pets, and she goes, oh my gosh, my doggy with IBD, she's like, no wonder he wouldn't eat, because she would be preparing his food. And she said she'd be crying because she wouldn't be expecting him to eat it. And he was, going through all this challenge with, his intestinal health. And she's preparing all this food, hoping he'll eat it. And she's crying, and she'd serve it. And doggy would look up at her like, and not eat it. And I'm like, well, he's probably like, Mom, you're crying. This is no time to eat. What's wrong? Pets are so empathetic that, and she was like, I bet half of the reason he wasn't eating was my energy, And so it is really nice to have that understanding. And, we can't be perfect, and we don't want to add any guilt to it, because, it's
that does not help energy.
Stress is difficult to mitigate, but awareness is the first step. And, anything we can do beyond that is, step in the right direction.
That's a great little extra tip for those of us that are dealing with cats with kidney disease and, are, in later stages, or having, appetite issues or whatever it is. Like we tend to be extra stressed about our pets, that makes our pets extra stressed. Right. And so it ends up being the cyclical type issue that is not getting better for any of us. And so taking those, whatever it is, a meditation, prayers, music. I'm really big into music therapy. I'm really big into exercise and run, things that
you have to find what works for you.
Yeah. Whatever works for you that helps that stress level down and
mind.
Center yourself a little bit
more.
I'm
putting that in my pocket.
Yep. A lot of meditative experts talk about monkey mind. It's just like,
monkey mind.
Yep.
Okay, I'm going to try to see if we can get it. I love that our beautiful Pam Roussel is here. Des, Shayna, so many beautiful people here tonight. And Marilyn said, Jay, you are always stressed. We might be twins. Marilyn, I love you so much. But there was a question about, or are you seeing them before me? I'm trying to scroll. I thought there were a few good ones in here. Just a second.
Well, some of them were already being answered too.
Oh, what about homemade food made with high quality protein? Should it be raw or cooked? Is that does that depend on the individual pet, in your opinion? What are your thoughts?
I agree. I think raw is generally, raw would be ideal, if they will eat it and they tolerate it well. So again, everyone's an individual. So what I like to say, with cats and with dogs, is raw food is my top bar. I feel like that's what we should strive for if we can. But not every pet at every point in their life is potentially a good match for that. So, there may be a time where they either don't want to eat it, or for whatever reason, their digestive system doesn't do as well on it, etc. Right. So as long as, the freshest we can get, the better. So raw is amazing, gently cooked, or, freeze dried or air dried. Granted, they're not moisture rich, high quality canned. I mean, everything has its place. And I'm always I tell people I love to combine and, mix and all kinds of stuff. It's not a one or nothing else. And so, there can be different formats of food that are combined or rotated or whatever, but certainly raw, I think, is ideal if possible.
Yeah.
I love that.
Yeah. We really believe that variety is key. Variety in proteins, variety in brands, all of those things. And now even variety in types of food, for our cats, at least, this is one of our oldest at 6.5. She's going to be 7 in March.
She's young.
She's a baby.
And so we feed them raw twice a day for their main meals. And then they get freeze dried and some canned food in the afternoon for their. So it's right.
Variety is
Yep.
key.
Variety is key. And, and it's nice to not be boring too. I mean, it's really nice for especially kitties. I mean, they like variety, and variety's better metabolically for, the body anyway, but it's also more fun. So let's
Well,
have a fun life too,
I love that
Exactly.
you said that, because I think so many people think, oh my God, I found a food my cat will eat and that's it. What happens when the pandemic hits and they run out of cans, or what happens when that food has a recall, or what, do you know what I mean? Like, I know that it can be difficult to get your cat adjusted or used to numbers of food, a different variety, but it can be life-saving.
Yep.
And we are the ones that teach them what food is. So it is about always giving them different options. And I
Yep.
did find another question that I wanted you to answer. Donna Marino said, what do you do with a cat with kidney disease that won't eat? I've tried every food and he won't eat, and he needs an appetite stimulant. At that point, what are your...
Yeah. So, and again, I guess as far as the pharmaceutical appetite stimulant, one of my mantras is, I'm really not against any pharmaceutical, at least temporarily, to try it if you feel like, I'd always want to cover bases first with holistic and integrative and natural things. But if you've tried a bunch of stuff and something's not working, I am not against going to a pharmaceutical. So, everything has its place. But, there are things that we can do, naturally too. And one of the things that I would definitely recommend is either a vitamin B12 supplement and or testing the B12 level, because vitamin B12 is a natural energy enhancer. It can naturally boost the appetite a bit. The kitty can just feel so much better. It is very, very common to be B12 deficient, especially in anybody older, no matter what species we are. And then if there's a chronic, condition going on, B12 is often low. So even that in and of itself. Other things that can also boost the appetite: acupuncture. Acupuncture. I love ozone therapy. We offer that at my practice too, and that might be a little bit less accessible, but there are a lot of holistic vets that offer that. So, any kind of sort of hands-on treatment, even energy treatments and, other things, can also really just boost the overall well-being. And then another amazing supplement that we could talk about is CBD, cannabinoids. And cannabinoids, man, there's just so many good things that they can support the body with because of that whole ECS, the endocannabinoid system in the body. Literally, there are receptors throughout the entire body in this, cannabinoid system. And we really know that it really helps to modulate well-being on so many levels, from gut health and kidney health and brain health and, all kinds of organ systems. And you can literally just feel better. I mean, that's one of the attributes of it is just overall well-being. And it's amazing sometimes what CBD can do. So that could, and sometimes honestly, it's actually just an appetite, kind of like people say, get the munchies when you have marijuana. I mean, CBD literally can support appetite too. So very specifically for that, but sometimes it's sort of secondary. The appetite improves because you just feel better and you feel more like eating.
Exactly. And the inflammation is down. So, so for some references, Donna, we do have at twocrazycatladies.com, we have an awesome B12 supplement that you can check out. And then cbdcathealth.com has a full spectrum CBD. Cool thing that we learned about CBD is for cats, because it's harder oftentimes to get that on their gums, right? For cats versus
traumatic.
Dogs, right? So you can also put it on their paw pads or rub it into their inner ear. Yeah. And that's just a less invasive way to give it to our cats. So we're not stressing them out while trying to not stress them.
A little
What would be cool too is if you put it on the paw pad, if they lick it, then it's like double whammy awesome. Because then they get transdermal and some lingual at the same time. But if you put it on their ear, they can't lick it. But if you put it on their foot, they might just lick it. And that's really
Exactly.
my foot. You just put something on my foot. I'm gonna clean it.
Yep.
Right?
Yep. That's
They
what
have
they
to
do.
clean it.
They have to.
Donna, I mean, I think that it's so important. I am one of those people where food is my love language. My cat's not eating, it freaks me out. So it messes with my energy. So just to go a little woo-woo on you for a second, Donna, I will say the energy of the stress of the situation, him not eating. With our Oliver twist, before he passed, he was a raw fanatic. And he stopped eating the raw. And we did an animal communication session with the beautiful Karen Dendy Smith with the Animal Communication Collective. And he said, it's too rich. He needs it cooked. So it might be worth asking.
Absolutely.
Your cat might like
I would try every format of food that's quality and, see what, and again, rotate. Oh, and another thing that I love to talk about too with kidney issues with kitties and dogs is raw milk.
Yes.
So they will drink raw milk, and cow milk is good too. It doesn't have to be goat milk in my personal experience. I don't know what your experience is, both of you, but I would say that a decent number of cats are not fans of goat milk, but they will drink cow milk. Okay.
Yeah.
And cow milk has a more subtle flavor. I mean, we know goat cheese and goat milk has that strong flavor to it. And, but cream that is, raw cream or raw cow milk, much more, palatable and smooth and all that kind of stuff. And so raw milk is an amazing health food, and it is great for kidneys too. It's kidney friendly, especially too, because we know that a lot of the phosphorus content that we worry about, the higher phosphorus foods, as kidneys become more of an issue, meat has a lot of phosphorus in it. That's one of the biggest contributors of phosphorus in the diet, and meat has to be. It takes a lot of. That's where digestive enzymes come in too. Meat takes a lot of effort to break down and break down the proteins into peptides and molecular amino acids that can be absorbed into the body, and that's a lot of effort. And then the kidneys have to excrete all the byproducts of that breakdown, so they've got the aftermath of all of that. Well, when anybody's drinking raw milk, those amino acids are already broken down. There is no effort to get them. They call them free amino acids. They're ready to go. They're ready to absorb and utilize, which makes it a very accessible, bioavailable food. It's totally complete meal, which is beautiful. And it's liquid. So you're like a hydrating meal. It's yummy. It's medicinal. It's kidney friendly. So
And
if kids will do raw dairy, it's such a beautiful thing.
Yes, Donna, try some raw milk.
I love it.
Yeah,
I love it.
for sure. For sure. Okay. I know we're way over time.
I know. And I know we probably missed a bunch of questions, you guys, but please reach out to us.
We're going to have you back, Dr. Because
yes.
like I feel like we could talk forever, and you explain things so well. You just break it down to where it's so digestible to us and understandable. So thank you.
Absolutely. My pleasure. Thank you so much for having me on. Thank you for all the beautiful, great work that you both do. You are such a gem to this industry, and it's literally and your energy is just beautiful and off the charts, both of you. So every time I get around you, I'm just like, woohoo, vibrations higher. So thank you. Literally at this talk about vibration. Thank you for helping all of our vibration to exceed higher when you touch any of us through all that you do. So thank you. Even just the intro coming into today, that fun, I'm like, I already feel like my vibration's higher because you guys are so much fun. So thank you. Deliver all of this good information in such a beautiful, high energy way that it is unique and it is a treasure, and you guys are awesome. So thank you for having me with you today.
I wish it was in person. I just want to hug you. Thank you so much.
We will.
It's coming.
Yes. Okay. And thank you all for joining us.
A reminder to everybody: the links for Dr. Katie Kangas are in the description of this video. So please.
Yes, thank you. Yes. So we're at Integrative Care and Dr. Katie Kangas and Share Your Bowl. So
yes. Yep. Links are in the description here. So if you have any questions, you guys reach out, and have a beautiful day. We love you all.
Love you. Good night, everybody.
Bye, guys.
Bye, y'all.